Good afternoon, everyone. I'm Dr. Federica Pascale. I'm an associate professor of sustainable built environment at Anglia Ruskin University and also a research fellow at the Healthcare Improvement Study Institute. It's a pleasure to be here today to share insights from my fellowship project, Integrated, Sustainable and Resilient Healthcare Real Estate. So what are the challenges behind the project? First of all, the fact that climate is changing rapidly. The UK this year has experienced the hottest start of May, the warmest June on record, and heat waves are becoming a frequent occurrence here in summer. An analysis by the Weather Agency found that the UK has 50-50 chances of 40 degrees temperature again in the next 12 years, with temperature of 45 degrees or more possible even in today's climate. The second challenge is the link between climate change and healthcare. So healthcare is both a contributor and a casualty of climate change. The healthcare in the UK is responsible for 5.4% of its carbon emissions, which is a significant footprint for a sector dedicated to healing. However, how healthcare contributes to climate change is only half of the picture. The other half is that healthcare is also increasingly vulnerable to climate shocks. So let me give you some numbers. 10% of hospitals in England and 43% in London are at high flood risk. During the 2022 heatwave, 1/5 of the UK hospitals cancelled their surgical procedure due to extreme temperatures, and in addition, overeating incidents have nearly doubled in the last 5 years. And 90% of hospital wards are at risk of overheating. This brings us to the third challenge, which is the critical tension between mitigation and adaptation. Mitigation is about reducing emissions, which is essential for long-term planetary health, while adaptation is about preparing for impacts we can no longer avoid. Healthcare must do both. It must decarbonize while becoming more resilient to climate shocks. The National Health Service in England has addressed the need for mitigation adaptation by becoming the first healthcare service worldwide to pledge to become net zero by 2040 for emission indirectly controls. In line with this commitment, NHS Trusts in England are mandated to develop and implement green plans as part of their efforts to achieve the net zero target. These plans should detail the approach and the practical steps they will take over a 3-year cycle to reduce their emissions and enhance their climate adaptation. In collaboration with colleagues at the Brighton and Sussex Medical School, we conducted a thematic content analysis of 119 green plans. What we found is that while trusts in England are focusing their attention on areas such as governance, culture and behavior, resource conservation, travel and transport, and estate decarbonization, their focus mainly is still on mitigation with limited focus on climate adaptation. So let's delve a bit deeper into our analysis of the green plans, particularly around estate mitigation and strategies. So starting with mitigation, we found that trust commitment focused mainly on 3 key areas: reaching net zero through built asset management, heat decarbonization, and switching to renewable sources of energy. First, in terms of built asset management, we found a clearer emphasis on maintaining, refurbishing, and repurposing the existing estate, rather than developing new buildings. Second, when it comes to heating decarbonization, most green plans prioritize upgrading updated heating, ventilation, and air conditioning systems and transitioning to low carbon technologies, with heat pumps being preferred over combined heat and power systems. However, we identified a significant gap in the lack of passive retrofit strategies, such as improved insulation or natural ventilation, which are essential for effective sustainable decarbonization. Third, regarding renewable energy generation on site, most trusts reported generic strategies, apart from a noticeable emphasis on solar PV. Now, shifting to climate adaptation, this is where the picture becomes more concerning. We found that most trusts are still in an exploratory stage. Their planning efforts are largely focused on identifying climate-related risks and incorporating them into climate change risks assessment. However, when it comes to actual adaptation strategies, these tend to be more reactive rather than proactive. To address these challenges, we developed Ensure HRE. This is a research project which aims to create an integrated framework to support hospitals to develop mitigation strategies to help transition to zero carbon future by 2050 and adaptation strategy to respond to climate impacts. To guide this process, we adopted a participatory backcasting approach, working with a trust as a case study. Participatory backcasting is a methodology that helps stakeholders envision a desirable future and then work backwards to identify the steps needed to achieve it. So, starting from the future, to construct the vision of the sustainable and climate resilient hospital of the future, we organized a visioning workshop with a multidisciplinary group of stakeholders involved with the partner trust. From the stakeholders' perspective, it was clear that the hospital of the future could not be dissociated from the transformative changes occurring in society and healthcare system, particularly in healthcare delivery, patient expectations, and digital technologies. The participants envisioned the hospital of the future as the last resort in a new healthcare system centered around the patient, with care moved closer to home and facilitated by digital technologies. They believed that sustainability and climate resilience could be facilitated by a shift in care from hospital to community through a fully integrated care model, with hospitals playing a new role of control towers of the communities. So once the vision of the hospital of the future was completed, we started investigating how existing hospitals could achieve this vision. To this end, we ran 2 workshops with the estates and facilities management team working for the partner trust. What emerged during this workshop were numerous barriers that hospitals, estate and facility management teams face in pursuing sustainable and climate resilient hospital estate. We summarize these in 3 main areas: estate management, financial aspects, and organizational behavior. We found that these barriers can create biases that hinder estate and facility management's ability to set long-term estate goals and anticipate the effects of drivers for change, such as climate change. The project is still ongoing, and the next step of the project is the backcasting analysis, so to analyze which strategies can actually help us to reach the vision of the hospital of the future. But let me leave you with some interim conclusions. Climate change is no longer a distant threat. It is actively reshaping the healthcare landscape. Both healthcare providers and hospitals in particular are both contributors and casualties of this crisis, and the urgency to act is clear. While the NHS in England is making commendable progress in reducing emissions, a more integrated proactive approach is needed to build a truly sustainable and climate resilient healthcare estate. Green plans show that the NHS Trust's focus on mitigation mainly through refurbish existing estate, upgrading heating, ventilation, and air conditioning systems, and transitioning to low carbon technologies. However, passive retrofit strategies are largely overlooked. More importantly, climate adaptation planning is still in an exploratory stage, with strategies must be reactive. Future-based approaches, such as backcasting, that recognize the role of hospitals within a future-oriented care delivery system and future demand for climate change, can allow healthcare managers to investigate potential intervention pathways. However, entrenched barriers in estate management, finance, and organizational structure need to be addressed to enable an effective implementation. This is all from me. Thank you for your attention, and I will be happy to take any questions.